The mission of the Public Health Institute at Denver Health is really to improve the health of communities with our communities. So what matters most to us is that we are working with and to support our partners, be they patients, community members, our community health colleagues, other health systems, the local public health agencies, the Colorado Department of Public Health and Environment, and really beyond. We have work that extends regionally and nationally. We have experts that work nationally and internationally, really.
When I think about defining public health, it is a reclamation of what public health used to be. So in this country, public health has a dirty history of really only caring about some people. We want to change that paradigm. We want public health to reach all people, regardless of their income, their orientation, their race. I want public health to improve their lives, so that's through literacy, that's through advancing health for all, that's through ensuring that people can walk into one of our clinics and get quality care regardless of who they are, where they live, what they do. We address social and economic barriers among the people we serve by providing transportation and helping with resources such as housing and food assistance.
The 4 clinics at the Public Health Institute at Denver Health are the Immunization and Travel Clinic, the Tuberculosis Clinic, the Infectious Diseases Clinic, and the Denver Sexual Health Clinic. We also do a lot of work in the community with community-based organizations. What I enjoy most about working for the Public Health Institute at Denver Health is making the city a healthier and safer place to live and a better community. And we do this by the direct patient care that we provide, but also by the larger work we do, the advocacy that we do for patients, and some of the outreach events in our community.
There's always something new that we are doing and striving to achieve, whether that be racial equity, whether it be expanding our services in community, or just being in community. We have people who continuously fight for programs. Even if funding does go away, we will find other resources to continue those programs just because it's such a huge need for community.
I love the work that we do, I love the people that we serve, and I love our mission, really providing resources and healthcare for people who can't afford it.
In my time at the Public Health Institute at Denver Health, I have not been bored with the work that I do. It's been challenging, but also there's that reward
of knowing that there's an impact on community that we're here to serve.
Public health issues are always changing, and they require that we look back for historical attempts and then modernize and think of innovative solutions. We know that many of our public health issues have a lot of health disparities, and our team is currently developing training and resources to really help walk organizations through an anti-racist framework and to think about how they can change. I believe what makes us unique is being embedded in Denver Health, a large safety net healthcare system with community health centers, school-based health centers. So with our public health services, our ability to think about prevention, but also healthcare needs across the life course really makes us stand out and able to solve some of our biggest problems.
The Public Health Institute at Denver Health has several outreach programs within the department. So these include things like clinical outreach activities, testing for sexually transmitted infections like HIV and hepatitis C, immunizations, and tuberculosis. We also provide outreach activities to educate and engage the community in health promotion efforts related to chronic disease prevention and behavioral health. In outreach, we plan events in community settings so that we can serve people and engage communities where it's most convenient and accessible for them. At-risk populations often can't easily take time off of work or school, and they may not even have access to transportation. So therefore, we come to them and deliver information and care as conveniently and as timely as possible.
We really support Denver Health's mission as an anchor institution, and we really pride ourselves in being able to put resources back into the communities that we serve. And together we support the strategic initiatives within the hospital to really drive clinical systems change that help to improve the health and the healthcare for our patients. And I think that in the long run is really going to be what makes the biggest difference.